very good evening and welcome to the second part of the Weekend Prime, where we discuss issues to do with health here on Health Digest. And today we are just following up the discussion on HIV and what the world has made, or the milestones that have been achieved on HIV and AIDS since the epidemic was declared in the late 90s here in Kenya. And this year, the Kenyan government, that is the NARC, NASCOP, and other stakeholders had a theme that about stepping up the prevention of HIV and specifically youth in a plan. And this was focusing on the youth and why the youth are an important demographic in HIV. And during the World AIDS Day celebrations, I had a discussion with Dr. Keegan Bartilol, who is the director or the head of the National AIDS and STI Control Program. And this is just what he had to say about the youth and HIV. Let's take a listen.
51% of the new infections are among the youth. So this is a group that really would want to target. So as interventions come in as a country, as we focus towards the 90% of the people being tested, 90% of those who know their status are actually on treatment, and 90% of viral suppression. We have to target the youth. But on the youth, you have to put more emphasis. As the youth will tell you, if it's not for the youth, it's not by the youth, it's not for the youth. So we have to target the youth to make their own programs. And that's what we're actually focusing on. So one of the things that we do with the youth, one is that we have now developed guidelines on how the youth need to be engaged. There are youth-friendly services that they have to be provided to them. As they will always tell you, it's not just a youth service, it has to be a youth-friendly service where they can be able to access all services, not just HIV services. So the platform is getting bigger and bigger in terms of youth and their health.
So that was Dr. Keegan Bartilol, who is the head of NASCOP during the World AIDS Day celebration. And to have me discuss the issue of youth and HIV, in studio I have John Njoroge Mwathi, who is a consultant clinical psychologist at the Eastern Dinary AIDS Relief Program. And also I have Jacqueline Dache, who's the Adolescent and Young People Program Officer at the National AIDS Control Council. And I'll start with you, Jackie. Dr. Keegan is talking about youth-friendly services in our health facilities. Do we have these youth-friendly services for the youth?
We have to mention that that was part of our guideline or a policy that was passed some years back. And the implementation is currently underway. And in certain places, there are lessons that are being learned from the youth-friendly services, and in certain places it has not really taken the traction that it should. But with that said, it is important to mention that the leadership, whether it's at national and now county, because now health is devolved, should basically take up the issue of providing youth-friendly services in the different counties and strengthen it for it to address the needs of adolescents and young people.
Njoroge, I know you deal a lot with counseling the people who are living with HIV, and the youth specifically. Are they saying that they are actually having youth-friendly services in our health facilities?
Well, on the contrary, most young people feel that the services that are being provided are not youth-friendly. When we say that the services are not youth-friendly, we are saying that they look at the services that are provided as services that ought all are suitable for people who are actually older than they are. Because if you walk into a standard CCC clinic, you find a young person, a person the age of their father, a person the age of their mother, sitting side by side. This, of course, does not augur very well with the young people, in that we should appreciate that it is at this moment when they are looking for what we call independence, when they are looking for autonomy, when they are looking again at people who are out there not to judge them. Youth-friendly services, of course, encompass a whole, is a whole field about the kind of information you give them, the kind of staff who are serving them, the kind of materials that are available to them, and again also taking cognizance of the fact that most people are quite busy, that they do not have that extra time to wait at the clinic. They do not have that extra time again to keep talking to healthcare providers about issues they probably have learned over the internet or they've read over the books, and they would wish that they could be helped to access information either through computers, pamphlets, and again where they can come, meet, play games with each other, that kind of stuff. That is what would constitute what we call youth-friendly services. And that is what is lacking in this country. Yes.
Jackie, what do you have to say? Are we lacking these youth-friendly services, or are we making progress towards having them? Because I know some of the healthcare facilities have adolescent clinics or adolescent centers. Are these what could be, is being envisioned as the youth-friendly services?
I would say that, as I said earlier, this discussion on youth-friendly services did not start 5 years ago or 8 years ago. It's something that has been a subject of discussion for quite a while, for probably around 10 years. That's why there were guidelines that came out of it. I would give an example of Kenyatta National Hospital, who are doing a very sterling job providing youth-friendly services within that referral hospital. So we are saying that progress has been made by different partners, by different stakeholders. And as interventions are being implemented, it is important for lessons to be drawn with them, because sometimes the definition of what was youth-friendly services 10 years ago is not necessarily what is going to cater for the needs of young people today. Yeah. And therefore, with that and the changing times and the changing interventions that are coming up, it is important for us to draw lessons. And if the interventions do work for adolescents and young people, which is being documented by research organizations that are partners to National AIDS Control Council and Ministry of Health, consideration to scale them up would be something that should be taken up. Yes.
Okay, I'll just hold that discussion on youth-friendly services for a bit so that we address one of the issues that have really come out about the youth contributing 51% of the new HIV infections. And this was really broken down to about 97 youth or young people get infected every day in Kenya. And this is quite a big number. Why are we seeing these numbers, Jackie?
There are various driving factors that are leading to the epidemic, increase in the epidemic, the HIV epidemic amongst adolescents and young people. That data is very accurate, where adolescents and young people between the age of 15 and 24 are contributing to 51% of all adult infections and 46% of all new infections. We have behavioral factors. These include early sexual debut, whereby you find that as much as it has increased from 14 to 16 right now, we have many young adolescents and young people engaging in sex at an early age, in fact contributing to a lot of high pregnancy rates in the country. We also have issues to do with alcohol and drug abuse. Low condom use should not be forgotten. We also have school dropout rates, because we do know that education provides protective factors and it reduces vulnerability and the risk of acquiring HIV. And the more our children drop out from school, the higher the risk of acquiring HIV because of being youth out of school. We also have issues to do with concurrent partners, where they're having relationships with many partners. The sponsor phenomena that has caught up and has become a social norm in this country, where it's fine to have intergenerational sex, and also low testing that is being observed amongst 15 to 19, whereby most adolescents and young people, less than 50% of them, do know their HIV status.
I want Njoroge to also chip in just on that, because you deal with these young people at a point where they're most vulnerable. From your experience and from what you have seen, what is really driving these numbers that we are seeing among the youth?
Well, I want to say that she's made a very good summary of some of the major factors that are fueling the spread of HIV. But one other thing we need to know, number one, is that our youth lack life skills which are, would actually help them to be able again to keep off, or may I say, prevent them again from getting HIV. When I talk about life skills, I'm talking about issues of being assertive. Do I just engage in sex just because my peers are doing so? Do I have the ability to say no to pressure from other people? Do I have a sufficient self-esteem for me to feel that I do not necessarily have to engage in sex so that I am referred or am considered as a person who is mature enough? Because outside, young people will tell you, oh, come on, if you've not had it and you're this age, you are probably you've been overtaken by time. The other thing that I want to talk about here that could be fueling this infection, he's talked a lot about drugs. Drugs in this country, particularly for persons who are injecting themselves, the so-called IDUs. We have not drawn a line between what constitutes a sickness and what constitutes crime. The person again caught injecting themselves with say heroin or any other kind of drug is considered a criminal. But medically, this person is a person who needs to be helped and treated. Look at the issue of depression. Mental health issues, and depression is part of it, is something that we have not been routinely screening for persons who are HIV positive. And data has shown that we have over 30% of persons who are HIV positive who have depression. And this, to a large extent, interferes a lot with how people make decisions, either to stay safe or either to engage themselves in risks that probably might bring them HIV. Then, like I said again, look at the students who are maturing right now. I like the clip you played much earlier here about the pastor who has adopted 2 girls. Young people who are going to high schools, particularly boarding schools, with the exception of matrons and school staff who are sensitive to the issue of stigma, are left by themselves to find out how they can be able to take their drugs and not let others know about it. And when other people run that these people are taking drugs, they quit taking their drugs. And you know the dangers that you accompany this kind of this kind of practice. So I believe the youth agenda, the issues of how we manage this is quite important, and I'm happy that NAC is implementing this. I'm happy other organizations are also coming up, but I would want to say that this is something that we need to do much more than that. That we can at least have some form of impact on the issue of HIV infection in this country. The other thing is not utilized much, the issue of research within particular facilities. Previously, I remember we used to carry out what we used to call client exit interviews. And these client exit interviews used to give us a lot of information about what people want, particularly the young ones. But today, we are the guys who are making decisions for them. Are these the right decisions for them? I do not know.
Okay, you have raised quite important issues there on taking drugs, or also the injecting drug users, or mental health, and they all, I think I can sum them up as the issue around stigmatization of people living with HIV, stigmatization of some of these conditions, like those who injecting drug users and people suffering from mental health. So I want us to take a break, and after the break, we'll just pick it up from there. We'll discuss stigmatization about the youth who are either infected or who are at risk of being infected. That's where we'll pick it up after this short break.